Alcohol with mood. I'd like to explain this station in a nutshell. This station is composed of two separate stations. We all know that assessment of depressive illness is a one separate station in CASC exam, and also assessment of alcohol dependence is another separate station. But this station, alcohol with mood disorder, is a combination of those two stations. And the most important thing is to know when to stop while taking history of depressive illness or of alcohol. I prefer to start with taking history of depressive illness because talking about this will give you a good chance to empathize with the patient and to make good rapport in comparison to start this station with talking about alcohol drinking. And we all know that for history taking of any psychiatric disorder, we need to assess core symptoms of that disorder and the impacts of symptoms and the ways of coping with it, and then to assess comorbidity associated with it and risks and past history of it. Here in this station, no need to take any history regarding comorbidity or risks or past history. Just it is enough to assess presence of core symptoms and their impact and how does he cope with that. The same also is true regarding alcohol history. We all know that in alcohol history, we are usually taking current pattern of drinking alcohol and longitudinal history of alcohol drinking, and then to assess the impacts of alcohol drinking and motivation to stop drinking. Here in this station, you need only to assess current pattern of alcohol misuse and longitudinal history of it and some symptoms of dependence syndrome. And in the last minute of that station, you need to make a link between the depressive illness and the alcohol drinking. Which one started first and which one is a result of the other one? I mean, there are two scenarios. The first one, that the patient started to be depressed and then he tried as a self-treatment to cope with it by drinking more frequent alcohol. The other scenario is that the patient increased his alcohol drinking for a reason or another, and then depressive symptoms started to appear as a psychological complication of alcohol drinking. And start this station with open mind, because you will never know which disorder started first unless you take the history in appropriate and in correct manner. And I hope these steps regarding this station are helpful to all of you, and thank you.